Uganda is dealing with an active Ebola outbreak confirmed on Thursday. The deceased was a health worker at Mulago National Referral Hospital who sought treatment in Matuga, Mbale, and from a traditional healer.
Though this patient was our work and working on the ward, from the teams that he was working with, no one has shown any sign or symptom of Ebola, and no history of the patient that has been listed as the potential source of infection.
Ebola is severe and often a fatal viral infection.
Spreads through direct contact with infected body fluids or contaminated objects. The virus can be transmitted through human-to-human transmission, via direct contact, through broken skin or mucous membranes, with blood or body fluids of a person who is sick with or has died from Ebola. It can also be the contaminated objects, such as medical equipment or personnel items that have come in contact with infected body fluids, can be the source of infection. The close contact with the blood, secretions, organs, or bodily fluids of infected animals, such as fruit bats, chimpanzees, gorillas, monkeys, forest antelope, or porcupines found sick or dead in the rainforests, can be also a source of infection.
And a person with Ebola might present with several symptoms.
Start with fever, fatigue, headache, vomiting, diarrhea, chest pain, and later a patient can start becoming restless, bleeding from all sides, and many times also they present with yellowing of the eyes. Bleeding is a late manifestation, so you will always see the bleeding at the end point, but the initial symptoms are always non-specific, and therefore many times can be confused by any other infectious diseases.
Whereas it is highly contagious, Ebola can be prevented.
The public is strongly urged that we avoid physical contacts with individuals that are exhibiting Ebola symptoms. Maintain strict hand hygiene. We request that even at workplace, we must constitute the hand washing or use of alcohol-based sanitizer to ensure that we avoid any form of contamination. We encourage you to avoid any bodily fluids that include urine, blood, sweat, saliva, vomit, stool from anyone you suspect to have symptoms that are Ebola-like. But it's not only just enough to avoid, but it is also important that you report for action. We are also calling upon the public, especially those that traditionally that have the habit of managing bodies. If you have anyone who has died with suspected symptoms of Ebola, please do not handle the body.
The Ministry of Health is isolating contacts and those known to have had contact with the index case. By Thursday's announcement, 45 people were already in isolation and will be there for 21 days before they can be let to rejoin with their communities.
Apart from the designated places that we have mentioned, the rest of the places are safe. It's not the whole country that is unsafe. It is not. It is only the places we have mentioned. When somebody has not developed symptom, is not infectious, because people will start now running all over the place that Mulago will not show up, and No, we want to allay this anxiety.
The last Ebola outbreak in Uganda was declared as over on 11th January 2022. Walter Mwesigye, NTV.